Hello everyone. Today we will be learning about the shoulder joint. If you find any difficulty understanding other topics, please let me know in the comment section. I will try to cover them. So the shoulder joint is composed of clavicle, scapula and humerus, and it is composed of four most important joints that are sternoclavicular, acromioclavicular, glenohumeral and scapulothoracic. In these first three are structural and scapulothoracic is functional. Why functional? Because it does not have any synovial cartilage or fibrous joint. The function is to allow the hands to move in a wide range of spare, and the shoulder complex is a classic example of dynamic immobilization, which means that the very few passive resistance are involved in the joint. It is a plain synovial joint because it's minimal joint congruency and it provides structural attachment. It provides the three degree of motion: elevation, depression, retraction and protraction, anterior and posterior rotation. Next is acromioclavicular joint. It is also plain synovial joint and it provides 3 degree of freedom. You will see the diagrams here and you have to draw all the diagrams. Next is scapulothoracic joint, formed by an anterior surface of scapula with the thorax. It is not a true anatomic joint because it is not union of bony segment by the fibrous and cartilaginous or synovial tissue. Next is glenohumeral joint. It is the most important, ask for 7 marks and 15 marks also. So the type is ball and socket variety of synovial joint. It provides the 3 rotational and 3 translational degree of the freedom. Proximal articulation is glenoid fossa and distal articulation is head of the humerus. Next is the angulation. First is angle of inclination. It is an angle formed in a frontal plane between the axis passing through the humeral head and neck and longitudinal axis. It is usually measured between 180 to 150 degrees. Second is angle of torsion. It is angle formed in a transverse plane between the axis passing through the humeral head and neck and axis passing through the humeral condyle. It is measured around 30 degrees posteriorly. You will understand better from this diagram. Next, write about the attachments. First is glenoid labrum. It is a fibrocartilaginous rim attached at the periphery of the glenoid fossa. The function is to increase the congruency and act as a shock absorber. Second is joint capsule. It is a large loose capsule that is taut superiorly and slack inferiorly. Now the ligaments. First is glenohumeral ligament. It has a three parts: superior, medial and inferior. The ligament contributes to an anterior and inferior stability by limiting an anterior and inferior translation of humeral head. Second is coracoacromial ligament. It starts from the coracoid process and has a three bands. The bands tends to prevent the inferior translation of humeral head. You'll see in the diagram the three bands of glenohumeral ligament, and at the superiorly that is a coracoacromial ligament. Till now we have covered the introduction, attachments and ligaments, and the introduction of the forejoint which makes the shoulder complex. Now we will see the kinematics. In this first is osteokinematics. I've covered this in previous video. So for the shoulder joint, write about the movement: flexion, extension, abduction, adduction, medial and lateral rotation. Write about the plane axis and range of motion and restrictions. Next is arthrokinematics. For the movement flexion, it rolls anteriorly and glide posteriorly. For the extension movement, it rolls posteriorly and glide anteriorly. For abduction, it rolls superiorly and inferiorly, and adduction rolls inferiorly and glides superiorly. Next is kinetics. The force producing motion or maintaining the equilibrium in shoulder joints are static stabilization. It is separately asked. Means in a static position, the head of the humerus is stable against the glenoid fossa. Owing to incongruency of the glenohumeral joint, it is not possible for the bone surface alone to maintain the stability for the joint. When head of the humerus is rest on a glenoid fossa, there is a directly downward force acting due to the gravity parallel to the shaft of the humerus. To counterbalance this force and to generate the equilibrium, the passive force is of the deltoid, supraspinatus and long head of the both biceps and triceps work. This when the arm is at a side, this vertical force is balanced by the passive tension of rotator interval capsule, which consists of ligaments, and hence the vector resultant is produced in such a direction which compresses the humeral head into inferior angle of the glenoid fossa. In healthy joint, the capsule has an airtight seal which produces a negative pressure. This pressure creates a relative vacuum that resists the inferior humeral translation caused by the force of the gravity. Next is dynamic stabilization. It is seen that the shoulder constrains the humeral head in the center of glenoid fossa throughout the motion, and as I described earlier, it is not possible by the passive force alone. Thus, the dynamic stabilization will have to work in a very synergistic fashion in order to attain such a stability. Next, the deltoid muscle and the GH stabilization. The deltoid muscle is prime mover along with the supraspinatus for an abduction. The action line of all three segments of deltoid follows the line of pull of the middle deltoid. You'll understand this through the diagram easily. The resultant, which is F4, dissolve into very large translatory component, which is Fx, which means an isolated contraction of deltoid will cause a greater translation rather than rotatory action. Usually the force component parallel to the long bone has a stabilizing effect because of the parallel component contributing to the joint compression. But in this case, the parallel component is Fx produce shear force rather than stabilizing effect. Although the deltoid is a prime mover, during abduction it cannot perform it individually due to lack of rotatory component. So that is why the supraspinatus act. And then the role of rotator cuff muscle sets in a work synergistically. Then this is the diagram how the resultant force is created. Now the rotator cuff and GS stabilization. In rotator cuff, the muscles are supraspinatus, infraspinatus, teres minor and subscapularis muscles. This combinedly called as sets muscle. The infraspinatus, teres minor and subscapularis muscle individually and together is called as its have a similar line of pull. The perpendicular component Fy compresses as well as rotates and parallel component helps. The supraspinatus has a superiorly directed parallel translator component Fx and perpendicular component Fy that is more compressive than that of the other rotator cuff muscle. The nearly equal and opposite superior and inferior force for the deltoid and the three rotator cuff muscles acting on a humerus approximate an almost perfect rotation of humeral head around a relatively stable axis of the rotation with a minimal translation. So this is how the muscles helps in action of a shoulder joint. Not only the deltoid but the supraspinatus, infraspinatus, subscapularis and teres minor also initiate in action to produce the resultant force and produce the effective movement. So till now we have covered the most important topic, that is introduction, ligament attachments and the four joints and also the kinetics and kinematics, then the dynamic and static stability and the muscles which stabilize the joint. I have diagram on each pages, so understand according to the diagram you will remember it easily. Thank you so much for watching. Hope you understand it. Please like, share and subscribe to the channel so you will get another videos also.